I would now like to provide an update on our vaccine rollout and milestones achieved to date. And the next slide, thank you. Since my last update, Health Canada has approved 2 new vaccines. AstraZeneca and the Janssen vaccines have been approved for individuals aged 18 years of age and over. The Janssen vaccine is the first single-dose COVID-19 vaccine approved for use in Canada. Both vaccines are much easier to store and handle than the 2 mRNA vaccines, making them ideal for mobile clinics and use in primary care offices. Early discussions indicate that the Janssen vaccine may be designated for those who may be hard to reach for a second dose, such as migrant farm workers and individuals experiencing homelessness. While the AstraZeneca and Janssen vaccines have a somewhat lower effectiveness score than the mRNA vaccines, they have been shown to successfully reduce serious COVID-19 illness, hospitalization, and death. As a point of reference, the annual flu vaccine generally had lower effectiveness, yet we promote these vaccines widely on an annual basis as an important tool to reduce the burden of influenza in our community. The week of March 8th, select pharmacies in Toronto, Kingston, and Windsor began administering the AstraZeneca vaccine. In addition, primary care providers in Hamilton, Toronto, Guelph, Peterborough, Simcoe, Muskoka, and Peel have begun administering the vaccine. Additional pharmacies and primary care providers in additional regions will obtain the vaccine as directed by the province. The AstraZeneca and Janssen vaccines are not currently available in Halton. However, we look forward to having them be available very soon. Next slide, please. Halton launched a clinic booking system on March the 3rd because the provincial booking system was delayed. The province has since launched its booking system and customer service desk on March the 15th. The provincial system does not allow individual health units to open bookings for additional priority populations. And this is challenging because if vaccine is available and bookings for a particular priority population are slowing down, we need the ability to expand eligibility. So we are continuing to assess the feasibility of transitioning to the provincial system at a point in the future. For now, Halton will continue to operate our own booking system. If Halton residents try to book appointments through the provincial booking system, they are being redirected to the Halton booking system. Next slide, please. So this slide will be familiar to you from my previous updates. It provides an overview of Halton's vaccine distribution plan, including the approximate number of individuals in each priority population group. We've been updating this figure as more information from the province is received regarding the definitions of populations to be prioritized. There have been 2 changes since my last update, which I would like to point out. For the number of individuals with chronic conditions, we refined the estimate to only include ages 16 to 60, or 64 rather, as older adults are captured in another priority group. And for essential workers, we updated the number to reflect the latest list of essential workers identified by the province as being eligible for vaccination in phase 2. It is important to note that the numbers on the slide are rough estimates of the number of individuals in each priority population, and there is likely significant overlap across the groups. For instance, someone may be an essential worker and also identify as age 60 to 64. These numbers do not add up to total Halton's population. The target populations identified in phase 2 are based on age and risk in order to prevent death, hospitalization, and transmission of COVID-19. On Monday, March the 22nd, the province released further guidance for the prioritization of phase 2 populations. We are now reviewing the guidance document to ensure alignment with our planning for phase 2 in Halton. Next slide, please. This slide lists the priority populations that are currently eligible to receive the COVID-19 vaccine in Halton. I'm happy to share that starting this Friday, March the 26th, adults 70 years of age and older will also be able to book an appointment to be vaccinated. We will be providing communication about this expanded eligibility starting later today. It is important to note that we are following the eligibility criteria outlined by the province, and we are unable to provide exceptions. We are also unable to provide exceptions to the timing of the second dose interval, as we are required to follow provincial guidance on this matter. Ultimately, delaying the second dose allows us to expand our eligible populations more quickly and allows more people to receive the high level of protection of first doses earlier. This increases our community level protection and will bring us all closer to a post-pandemic world. Next slide, please. So as you all know, 5 vaccination clinics were opened in the month of March, making a total of 6 clinics here in Halton. The Pfizer vaccine is being administered at these clinics. Opening 5 clinics in 1 month was a significant accomplishment that required a great deal of work by many staff across the corporation. It also involved a strengthened partnership with the Joseph Brand Hospital. As clinic processes become established, we are ramping up clinic schedules. Less time is being allowed for each appointment, allowing vaccination of more people by the same number of our staff. As always, the capacity of each vaccine clinic is dependent on vaccine supply. Halton Healthcare remains the only site providing vaccination for healthcare workers. All other eligible groups may be vaccinated at any of these 6 clinic sites. Next slide, please. Mobile clinics of Halton paramedics and public health have now completed vaccination in our 18 long-term care homes and 16 high-risk retirement homes. The current focus for mobile clinics is to complete second doses for our non-high-risk retirement homes and our high-risk congregate settings. Our goal is to complete these second dose vaccinations for residents in non-high-risk retirement homes by March the 27th and high-risk congregate settings by March the 29th. In addition, first doses are simultaneously being administered to congregate settings for older adults and other high-risk congregate settings, including correctional facilities, group homes, and community living. This will take us right into the month of April. Next slide, please. So to recap, the slide shows our vaccine rollout progress since my last update. As you can see, March has been a very busy month. We opened our 5 community vaccination clinics across Halton. In addition, as of February the 21st, residents of long-term care and high-risk retirement homes in Halton had received their second dose of vaccine via our mobile clinics. On March the 3rd, Halton's online booking system for residents aged 80 years of age and older was launched. Last week, staff and inmates of correctional facilities were offered first doses at mobile clinics. And last Friday, on March the 19th, adults aged 75 years of age and older and Indigenous adults 55 years of age and older became eligible for vaccination. And as I noted earlier, starting this Friday, adults 70 years of age and older will be able to book vaccine clinic appointments. Next slide, please. Despite the challenges to date regarding vaccine supply and provincial direction changes, Halton has made great strides in rolling out the COVID vaccine. As of end of day on March the 22nd, the Halton Healthcare Vaccination Centre at the Oakville Trafalgar Memorial Centre has administered over 36,000 doses of COVID-19 vaccine, while Halton Region Public Health and Paramedic mobile teams had administered an additional 13,341 doses, and our Halton community clinics had administered 11,394 doses since opening Saturday, March the 6th. Of the doses given at these community clinics, 98% were given to residents aged 80 and older, most of them individuals who reside in the community. This represents over half of the estimated 20,000 seniors aged 80 plus and older living in the community in Halton. While not all have received their immunizations yet, we have booked over 90% of these individuals for vaccine appointments since the launch of our online booking system on March the 3rd. This is in addition to the many individuals aged 80 and older already immunized directly in their long-term care and retirement homes by health department mobile teams. We've made significant progress, but it's important to remember that vaccine coverage is not yet widespread, and residents must continue to follow public health measures. The most recent report from Public Health Ontario, which includes data up to March the 13th, estimates that just 4.6% of Halton residents have had 1 dose of the vaccine. We will continue to refine this estimate and hope to include this type of information on our dashboard in the future. Next slide, please. We've consulted with and engaged with community partners to support the vaccine rollout. In preparation for the COVID-19 vaccine rollout to our older adults, staff consulted with various community networks in February, including our Older Adult Advisory Committee, Coordinated Relief Action Table, the Community Safety and Wellbeing Older Adult Isolation Table, and municipal communicators groups. The purpose of the consultations were to gather feedback from our older adult community and get input into what types of communication materials and channels would best serve this important segment of our population, given the unique challenges presented by the pandemic. Following these consultations, extensive connections were made with organizations that serve older adults, including 200 faith-based organizations, 60 service clubs, 25 cultural centers, and over 50 older adult serving agencies. These organizations were asked for their support with distributing vaccine materials and were also asked to consider how they could help older adults make clinic appointments or get to clinics. There's been a huge positive response with organizations eager to help make this initiative a success. Thanks in part to these efforts, 15,000 adults aged 80 and older were booked for appointments within a few days of launching our online booking system, and that number has grown over the last 2 weeks even further. We've also been seeking input about how best to serve our Indigenous peoples. To gather advice and guidance on how best to implement the recommendations provided by the Provincial Urban Indigenous Vaccine Distribution Subtables and on establishing an Indigenous Elder Advisory Committee, staff have begun consulting the First Nations communities, in particular the Mississaugas of the Credit First Nation and Six Nations, the Credit River Métis Council, Toongasuvingat Inuit, and highly regarded Indigenous healthcare professionals, Dr. Bond and Dr. Smiley. Halton continues to seek direction and guidance about which other organizations should be approached to solicit further guidance or resources. Integrating community leadership and elder advice into the vaccine planning for these communities will also build on best practice guidance articulated by Indigenous Services Canada, which is especially important in urban settings where social vulnerabilities are often less visible. We've also been seeking input from our healthcare community. The Healthcare Advisory Roundtable is led by Dr. Joanna Oda, our Associate Medical Officer of Health, and is made up of primary care, pharmacy, hospital, OHT, and LIN representatives. This group of healthcare professionals started meeting in February and has been contributing towards our planning efforts. As additional priority populations become eligible, we will look for other ways to consult and engage partners. We are grateful for these opportunities to inform the COVID-19 vaccine rollout across Halton. Next slide, please. As I mentioned at the beginning of my presentation, variants of concern continue to spread across Ontario. Now that we are in a third wave of infection, it is even more important that we follow public health measures. Vaccination continues to be an important tool in our future fight against COVID-19. The vaccine will help people fight the virus and make symptoms milder if they do get COVID-19. However, for now, even those who have received the vaccine must continue to follow public health measures until such a time as we achieve a good level of community-level protection. Staying home, maintaining physical distance, washing hands, and wearing a mask have been proven to reduce the spread of COVID-19. I want to emphasize that it is essential for us all to be diligent and continue to do our part to keep our community safe. Reducing cases, increasing vaccinations where they will have the greatest impact, and accelerating vaccinations overall are how we will beat the pandemic and get closer to normal. Thank you for your time and attention today. And with that, I invite any questions.